Really emailing Minister of Health, referencing my dad's case, social media, tagging that Minister of Health, really banging on the door of the Minister of Health, your local MP. I believe we're going to put something up to help people with that. But that really is it. Banging on those doors for those decision makers would be greatly appreciated. And then I'm hopeful with a podcast like this, more word getting out, people sharing these things, that common sense will prevail, because it is just that common sense. There's no reason to not have doctor-patient access to psilocybin guided therapy with the evidence that's available. It's just we just need a little kick in the butt of the decision makers to move something along here. I don't see a world in 2026 where that doesn't make sense. So.
Okay. Hi, everybody. I am your host, Kyle Siddick-Lumsden, and this podcast is brought to you by the Multidisciplinary Association for Psychedelic Studies Canada, or MAPS Canada. As MAPS Canada moves forward, becoming the leading source for information, resources, and advocacy in psychedelic medicine, we recognize the evolving nature of scientific knowledge. This podcast is for educational and informational purposes only and does not constitute medical, legal, or professional advice. Now time for a quick disclaimer regarding Health Canada's Special Access Program. This content provides general educational information about regulatory pathways and does not advertise, promote, or recommend any drug, therapy, or medical intervention. All decisions regarding treatment or access pathways must occur between patients and licensed healthcare providers. Access through the Special Access Program is intended to be discussed and initiated within a clinical setting between a healthcare professional and their patient. This podcast is independent and should not be interpreted as approval, review, or endorsement by Health Canada. As I am recording this podcast in Toronto, I would also like to acknowledge I'm on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is now home to many diverse First Nations, Inuit, and Métis people, and that this land is covered by Treaty 13. So I'm here today with Dr. Blake Pearson. He is the founder and medical director at Pearson Health, and an internationally recognized leader in the field of cannabinoid-based medicine. He is also a passionate educator and the founder of Greenlee Health, which helps healthcare practitioners further their understanding and integrate cannabinoid-based medicine into daily practice. Dr. Pearson has provided mentorship and training for over 1,000 fellow practitioners around the world and has extensive expertise using cannabinoids to manage conditions ranging from chronic pain, insomnia, and anxiety to traumatic brain injuries, treatment-resistant epilepsy, and autism spectrum disorders that have not responded to other therapies. Dr. Pearson also has significant experience in long-term care, specifically helping to manage responsive behaviors associated with dementia and using cannabinoids to reduce polypharmacy. Dr. Pearson was previously the primary care lead for the Erie St. Clair's LHIN's mental health addictions and opioid reduction strategy, and is a principal investigator on several current research projects. More importantly, for the purposes of this podcast, Blake is the son and patient advocate for his father, Pete Pearson. So to start us off, could you tell me about your father, Pete, and his life before his illness?
Sure. So my dad grew up around Sarnia, Ontario, and lived his life, raising his children, 2 boys, 2 girls. And he started out actually working for his father in the equipment rental business. So Pearson Equipment Rentals was started by his dad. So he had a long relationship with his dad, working with him and really learning, I would say, the value of hard work, because my grandpa kind of came up from nothing, built a business, and then ultimately my dad and his brother took it over. And so he was very hard worker, entrepreneur, business owner, and really a great dad. Like on the family side, wonderful, wonderful father, put his kids first every chance. My brother and I played AAA hockey, junior hockey, so he was always driving us everywhere. Kind of the classic Canadian dad, if you will, the 6 a.m. practices, and tournaments on the weekend. So couldn't have asked for a better upbringing. And that's a little bit about him. And then he went on to then sell his business to United Rentals about 15, 20 years ago, and then has been kind of retired. But a guy like that's never retired. Very busy, always wanting to help others, help us, check on things. And then up until his illness, that would be really a common thing, him popping by us, working on projects. And as his lung condition progressed, that became, harder and more rare, and now he's not able to do those things that he likes to do anymore, unfortunately.
Okay, thank you for letting us know and painting the picture of him as a person. I think that's very important to note. So you'd mentioned his illness. Can you tell me a little bit more about it and his current physical condition?
Sure. So he was diagnosed with idiopathic pulmonary fibrosis, which is a progressive lung condition and a progressive scarring of the lungs. So his lungs are scarring over year after year. Most folks with that have a lifespan of 2 to 5 years. Happy to say my dad's in year 6 after diagnosis, so he's kind of beating the odds there. But as you can imagine, scarring of the lungs, symptomatically, that really does mean worsening shortness of breath, difficulty breathing. And so because of that condition over the years, his activity levels gotten lower and lower. And now, towards the end stage here, he is on oxygen full time. And really now, even walking to the fridge or to the bathroom can be considered strenuous. So his condition is leaving him, really reduced activity, difficulty breathing. And with that, as you can imagine, that struggle to breathe is very anxiety provoking. Watching your body decline, not being able to do what you can do, knowing what you used to be able to do, is very anxiety provoking, low mood. So the condition is a cause for anxiety, and certainly knowing that, he's on borrowed time in a sense, because most people don't live past 5 years, and he's seeing the decline is, of course, really distressing for him as well.
Okay, thank you for talking about that. So I know there's a lot of research showing that there is significant suffering that comes from existential distress, and sometimes they call it demoralization that's associated with a terminal illness. So can you talk a little bit more about what his experience has been like with the mental health challenges that come with it, and how that has impacted his life as opposed to only the physical challenges?
Yeah, that is one of the biggest things, is the mental health side of it, because no doubt the physical component, it is an issue. The scarring of the lungs, the trouble breathing, that's one thing, and the anxiety that goes with it. But they're really still that existential distress that you talked about there, knowing that the end is near, but not knowing exactly when. They often say these folks can kind of fall off a cliff at the end, like you're not really noticing, you're right at the end, and then boom, a cold, something happens and really knocks you down. So his biggest issue right now is the mental health side, because he's been in and out of hospital admissions, um, for flares of the idiopathic pulmonary fibrosis. So each time he's knocked down another peg, the anxiety goes up. It's almost like a inverse relationship. The respiratory status goes down, the anxiety goes up. A reminder of his limited time here. And there's also an element of, unfortunately, I see him all the time. It's like still some of that, like not grasping that it's not going to get better, that anxiety around like, why won't this change, or how come I'm not getting better? Like, so there's that component too, which leads to a lot of anxiety. So as you could see in this picture describing my dad, it's really the anxiety around end of life distress, the anxiety around trouble breathing. Imagine you're short of breath, you're gasping for air. Of course, that's anxiety provoking too. So he has so many reasons why we're pursuing psilocybin guided psychotherapy to hopefully help ease some of this at the end of his life.
Okay. So you mentioned psilocybin therapy. How did he learn about psychedelic assisted therapy?
He learned about it through me. So in my work in nursing homes, long-term care facilities, mainly treating folks with dementia with aggressive behaviors, using CBD and THC to manage those behaviors across the province. I'm exposed to a number of elderly folks in different with different comorbid conditions, and even in my outpatient practice, chemotherapy-induced nausea, vomiting, folks with cancer pain. So the topic I began learning about it being kind of around these patients. And so I started to do some research, and of course, there is a large body of evidence growing from quality institutions like Johns Hopkins, for instance, but really showing benefit in end of life distress or existential distress. So I had kind of deep dived the research and, of course, watched some documentaries and really anything I could get my hands on. And it is quite compelling, the evidence. So there's a strong evidence base. And then I also was exposed to some people who were going through end of life distress, who had tried it, who also found great benefit, great peace with it, which is what I want for my father, is peace, and that acceptance and really reducing that anxiety. So a mix of the literature, the studies, which of course are very conclusive, in my opinion, at this point, and then that anecdotal experience of actually talking to folks and even counselors who had had experience with it.
Okay, great. So Canada's Special Access Program, which I had mentioned earlier, allows doctors to request unapproved, unavailable drugs or medical devices for patients with serious or life-threatening conditions when standard treatments have failed or aren't an option. So since January 2022, it's the preferred method for Health Canada to grant legal access to psilocybin for patients with end-of-life distress. What was the process like for Pete and his physician when they applied to the Special Access Program?
Um, Labor intensive, I would say. It's really, well, to paint a picture, you have to first have that discussion with your physician, which still unfortunately are a lot aren't well versed in the topic. But so you have to have a discussion with your physician, which of course makes sense. Then that physician, who are under a lot of time crunches as it is, has to fill out a good amount of paperwork, I would say, uh, for the application. So the SAP application, uh, the prescribing physician, in this case, my father's case, that his family physician, went through the process. Of course, with my guidance as well, we worked together on it because it actually is so labor intensive that it required two of us to kind of put it together. But you're referencing the literature, for example, as to why all the previous treatments prior that have been tried, of course, the medical history. Why are you applying for this? Um, there's a number of different things that they request, and it is quite labor intensive should the physician actually have time or agree to do it. But that's a little bit about it. We got the application together, and then a back and forth took place where they wanted more info. So send us the latest hospital discharge summaries. What was his recent admission all about? Did his condition decline? So there's the initial, then there's some back and forth. In this case, there was back and forth. And the frustrating thing was it was over months and almost a year of back and forth, which really kudos to his family physician for sticking with it. And but it's certainly the average Canadian, in my opinion, without their son being a physician and having a really great family doctor like that, that this access program is, in my opinion, not accessible at all, because only to find out after all that back and forth, us quoting the research, my dad certainly has a qualifying condition. He was declined ultimately about 11 months after we got the final denial.
Wow. Okay. So it took 11 months for them to reach a decision on the SAP application.
Yeah, there were some delays with get responses, and even a little on our end at one point, but the whole culmination of back and forth records, this requested, um, yeah, it was 11 months, and it's uh, it's it's wild because, or frustrating, because nowhere in this process did they speak with my father. We have technology now where you could arrange a Zoom call. You could see how he looks these days. You could see the distress. Um, and that human touch isn't there. It's just kind of a classic bureaucratic system, which, when you're talking about palliative care, end of life, the human touch is so important. And it's the wrong pathway for something like this.
Absolutely. And also, when they're making these decisions, you're talking about end of life care and palliative care. These are people with, projected to be shortened lifespan. So expecting someone to apply for what should be an emergency medication for it to take 11 months for a decision, or, I've heard many other cases that take very long for them to reach a decision when these people, I mean, the main issue is they don't have time.
Yeah.
So it's kind of absurd to put it into this lengthy process.
Yeah. Yeah. I would agree.
And so you had mentioned that Health Canada's decision was a rejection. What was their rationale for the rejection?
Really, in the quite lengthy document that was sent back, the Coles notes would be not yet, or not sick enough yet to warrant this behavior, and other modalities, even though multiple SSRIs, multiple rounds of counseling with different counselors had been done. That was really the essence of it. Was, he's not at 1 month, let's say, or 2 months left per se, 6 months, 8 months. We don't know, but that really was, in essence, the response. Like, not yet. You're not right there. And why that's so infuriating is, when is it the right time to process your own death? Like, he knows this is coming, and he knows this is coming likely within the next year. So why would Health Canada be in charge of deciding when someone could process their own death or live with some quality of life in those last months, and actually have a chance of enjoying the last 6, 7 months, or not being so anxious and on edge? Like, to give him that bit of peace in these remaining months would be a wonderful gift, and to deny it is just cruel.
I agree. It sounds very unnecessary and cruel in your father's situation.
Mhm.
As most people know in Canada, since 2016, Canada has had a legal process to allow an eligible person to receive medical assistance in ending their own life. So, has your father formally applied for medical assistance in dying, which is known as MAiD?
Yes, yeah. So after we got the denial, and his condition worsening, unfortunately, kind of right on the heels of that, um, we did apply for that with the help of his family physician. And you know that really is, uh, to when pulmonary fibrosis progresses, those last few days can essentially be like drowning to death, suffocating. And we, of course, want to avoid that for my dad. And so we applied for MAiD, and when that time comes, to give us an option that he doesn't have to suffer right at the end. So we wanted it in place. He's not at a point right now where he intends to use it, but it's certainly there, because at that point we don't want him to suffer like that. And one of the things that is possibly even driving the MAiD even more is the fact that his anxiety is so bad because of all of this that he he is considering possibly using it for that reason. Now those are candid conversations, and that is what happens with folks at end of life, like the stress of thinking about it every day. Sometimes people choose MAiD for that reason. And again, it's another reason why if we can approve the psilocybin guided therapy and give someone some quality of life, reduce their anxiety, you would reduce the amount of people who are using MAiD for that purpose as well.
Yeah, absolutely. And I think that does go back to some other cases and some research that I think everyone or most people would agree that access to MAiD for the very final end of life to avoid the worst of the worst form of suffering is an essential health service. And I would want that. I think most people want that. It's a safeguard so that, your final days aren't in total pain. But I think it's unreasonable if people are wanting to be motivated for MAiD or choose MAiD when they could have some quality of time left, but the anxiety and the mental health challenges are what is actually motivating that request. So I fully agree and understand with that. And I think that's a reasonable perspective that the government of Canada would agree with, or they should.
Yeah.
Okay, so procedurally, what was it like applying to MAiD compared to applying to psychedelic assisted therapy through the SAP? And how long did it take for Health Canada to get back to you about a decision regarding MAiD?
This is much different process for MAiD in that referral was made by his family physician to one of the MAiD specialists in our area. So it's not as if it's a federal or regulated pathway like the SAP. Thank God, because again, urgency, less bureaucratic BS, if you will, just doctor patient relationship, which of course that's the best way medicine works when it's doctor patient. So MAiD is in that vein. So his family doc made the referral. The MAiD team reached out. They had their visit, and then now he's kind of in that system. And should said time come, we have a lever to pull if we need to. So that process took about I would say about a month.
1 month. So it took about 1 month to apply and receive an acceptance or rejection from Health Canada regarding MAiD.
Yeah, not exactly from Health Canada, but from the team, MAiD team.
Right. Okay. Sorry. Yeah. Okay. So, I mean, this is a little bit of a loaded or sensational question, but I think it'd be important to ask do you think that the government has made it easier to access MAiD than it is to access psilocybin? So even though psilocybin has the potential to improve the conditions that can often motivate a MAiD request.
Yes, it's sad, but it's true. That process was so smooth for MAiD. Timely, like I said, a month, whereas we jumped through so many hoops to access something that's safe, well studied, and per a lot of the research, helpful, right? That overwhelming theme of peace, acceptance is so valuable. So it's mind blowing to think that is what we're jumping through the hoops for, as opposed to medical assistance and dying. Almost like it's an easier path there, an easier way out than actually doing the counseling, doing the work, improving someone's quality of life at that end of life stage, which has so much value. Just mind blowing to think of how much more difficult it is to access psilocybin guided therapy than MAiD.
Okay. Thank you for your thoughts on that.
Mm.
So you've been rejected through the SAP. How are you currently attempting to access psychedelic assisted therapy?
So now we have, because my dad's never tried psilocybin before, obviously doesn't want to break the law. So now we are going through a special exemption. I believe it's section or special exemption 56 or an S56.
Yeah, a Section 56 exemption.
So we've applied for that, which is kind of directly to Minister of Health. And this is kind of our last straw, another lever and another hoop to jump through to access this natural, safe form of treatment, is to go right to the Minister of Health. This is kind of the last one. We're banging on the door saying, you need to do something about this because this is wrong. So that is our kind of our final play here. We've put it in, and again, which really for most Canadians out there, they're not going to do that. They're not going to know about that pathway. They're not going to put together again the evidence and talk about the medical history. But we're doing it. We're not taking no for an answer, and so we're going through that pathway at the moment, and hopefully we'll hear back by Christmas from the Minister of Health to, in my opinion, approve this no-brainer of a case.
Right. So we're recording the podcast today on December 10th. So hopefully for the people who are listening or viewing this, Pete will have had access and a successful Section 56 exemption by the time they're hearing this, I hope. Maybe you could shine some light on what are the main differences between applying to the SAP versus a Section 56 exemption?
Hey, we hope you're enjoying the podcast so far. Now, if you want to support and become part of the psychedelic movement, feel free to donate to MAPS Canada at the link in the description below. Thank you for helping our mission to support equitable access to legal and regulated psychedelic medicines for all Canadians.
Well, I would say the Section 56 exemption is easier again than the SAP form. Seemed like just kind of almost like a one-pager, if you will, describe the condition, describe what's been done, therapies used, describe the symptoms that are ongoing, and then off to the Minister of Health. And we've actually already heard a response that they've received the application, which again, compared to the SAP form, you would go months without knowing anything. So the correspondence has been better. So I would say less labor intensive, better correspondence, but still we don't know when we're going to hear back and if it's going to be approved.
Okay. So fingers crossed, hopefully you hear back soon and it's a positive response.
Yeah, absolutely.
So as a physician yourself, what do you think an ideal system looks like to give compassionate access to psilocybin for this population?
So we don't need to complicate it at all. It's such an obvious distinction here. End of life distress, folks who are in their last year, 2 of life. I really think it's more than reasonable to have the family physician authorize that, or if some family physician, palliative care docs, anyone with training in it, but it should be open to all specialties. I wouldn't limit it to one specialty because end of life affects a number of different domains. But there's no reason that there needs to be this special access pathway. Doctor-patient, my patient has terminal cancer. They want to use psilocybin guided therapy at the end of life. Absolutely. Gladly write that for them. And then the combination of the therapy. So who's the designated therapist? Like you make a little framework of, the prescription and then liaising with the therapy team as well. But it's no different than any other medication. Like the physician could prescribe it. You have the therapy team. And just in that example, like, correct me if I'm wrong, but does that sound fairly logical? Let's say a terminal patient, end of life, comes to see me. They want to try psilocybin guided therapy, write the prescription. Fairly straightforward. Counseling done. I think that's the framework. The one thing I would add is if there was change, and I'm hoping there will be change immediately, 2026, to this outdated system. But one of the other big restrictions here is cost. It's one thing for my dad to get approved, but paying for the therapist time, the prep sessions are an hour times 3, the 6 to 8 hours during the therapy session with psilocybin. So this could range from $1,000, $2,000 for people, which is the next domino is coverage, because it will be a case of haves and have-nots, which of course is inequitable, and it will be a sad state of affairs. But first, let's get it to the doctor patient, and then let's move to a discussion around coverage.
Right. Yeah, it seems from what I know that the special access program was designed for novel cancer medications and other drugs like that psilocybin or MDMA, which they are using it for, is not it's not what it was designed for. And I think in the model you had suggested, physicians would also be able to do screening on the patients that if they did apply with end-of-life distress for that type of therapy, they would know if there was a family history of, say, schizophrenia or bipolar disorder, to be able to screen people out that it could actually have those harmful effects on.
Yes.
And then also it would be able to be cost covered under a Canadian healthcare plan.
Yeah.
So yeah, I think that just makes a whole ton more sense than providing access through the SAP, which I think personally is a sort of an inappropriate mechanism for access.
Yeah, agreed. And you make a great point. Like, continuity of care is so important. Doctor-patient relationship. Like, we know these folks; they've been our patients for years. So it's not as if you just approve everybody because they have end-of-life distress. Let's say in this case, there needs to be a review of their medical history, similar to what I do in cannabinoid medicine. Contraindications like schizophrenia, for instance. You mentioned bipolar. For this case, there certainly needs to be a medical review, and who best to do it than their primary care physician?
Yeah, and that would be the best sort of care as well. Obviously, you wouldn't just be prescribing it and saying, "Okay, you go home and take it." It would be, some type of therapeutic setting which doctors could observe, and trained people would be able to sort of help guide it for the maximum mental benefits.
Yeah. I think that model that's what really needs to happen, because family doctors, of course, busy, lots of different diagnoses, managing patients. So I really see the model as, the physician basically prescribing, and then a lot of the heavy lift going to the counselors and the therapists.
So do you and Pete consider yourselves advocates now for compassionate access to psychedelic assisted therapy?
It's one of those things. We didn't sign up for that. We thought actually this would be fairly straightforward, put in the application, and that's that. Given my expertise and of course his family doctor's commitment to this, but we now are certainly advocates for this, because the whole process has really shone a light on just how things need to change, very much so, because there's really inequitable access here for something that can be helpful. So it's, in a way, as weird as it sounds, a bit of a blessing too, because it's given my dad some purpose in the last year. That's something that does go away, purpose in life for folks, and to him to have this commitment, this passion now to do this, not only for himself, but he's getting feedback from people, words getting out. He's really energized that, if how wonderful would that be if in kind of the last stages he could make change and help other Canadians and other people. So it's blessing in disguise for that, for giving him kind of a renewed sense of purpose here.
Well, I hope the story of your father can potentially help people in the future, or maybe inspire some change with policymakers or whoever. Just that this is out there now, and it takes a lot of guts and courage that you and him have both been involved in this. So I know we all thank you for that. Um, so it sounds like Pete would be very reluctant to break the law in any capacity, but his situation and need for relief obviously are desperate and life-threatening, with the existence of the MAiD application. So has Pete considered the underground route for access?
Yeah, it's one of those things where we might just have to do it. So we've looked at all options. Initially, we were even looking at leaving the country, which is so sad, having to someone in his state having to leave. But there was an opportunity to go to a retreat in Jamaica that specializes in this. But he, unfortunately, another notch down and cannot make that trip. So that kind of oh, black market or gray market trip, although legal there, um, was considered, but given his condition, he can't. And if this Section 56 doesn't go through, yeah, we are certainly looking at all options because there are trained therapists out there. There's certainly safe avenues for the product in those markets. And knowing his medical history, no bipolar, no schizophrenia, there is this is such a well tolerated medication that it's one of those things where if we have to take matters into our own hands, that'll be considered. We don't want to do it, but it's something that if we're talking honest here, it's a safe compound. It's readily available, and secure tested sources. So not worried about contamination or anything like that. But it's one of those things where it's so funny in a sense again that all these hoops for something that is actually extremely well tolerated given its safety profile. So long-winded way of saying yes, we'll explore every option at this point because of the evidence. I want him to experience that peace, experience that reduction in anxiety, and I know that's right. Like reviewed the evidence with the medical hat on. There is nothing illegal about that. So no qualms about doing what we need to do.
Okay, good. I'm glad to hear that, and I think that most of our viewers would be as well.
Mm.
Are there any legal avenues you've considered? So, is there any action that you could take if the Section 56 exemption fails, like through the courts or hiring a lawyer?
No, at this point, I would just say that's enough. Like he's so fragile and kind of beaten down in a sense from this process that we're done in a sense. Like if you, SAP, no. Section 56, no. There'd be no other route that we would consider, or even traveling like to a state like there's a colleague of mine who has a setup out in Oregon, legal. Uh, there's some in Colorado as well, but unfortunately, given his state, he can't make a big trip like that. So we'll be doing things locally.
Okay. What if anything could help Pete's application, or what can our viewers do if we want to help?
Well, that is where this Section 56 exemption comes in. Really, emailing Minister of Health, referencing my dad's case, um, social media, tagging that Minister of Health, really banging on the door of the Minister of Health, your local MP. I believe we're going to put something up to help people with that. But that really is it. Banging on those doors for those decision makers would be greatly appreciated. And then I'm hopeful with a podcast like this, more word getting out, people sharing these things, that common sense will prevail because it is just that common sense. There's no reason to not have doctor-patient access to psilocybin guided therapy with the evidence that's available. It's just we just need a little kick in the butt of the decision makers to move something along here. I don't see a world in 2026 where that doesn't make sense. So FDA, I was at a psychedelic conference in Philadelphia a couple weeks ago. It looks like the FDA is going to be moving to approve psilocybin in 2026. So these big governing bodies are moving this way, and Health Canada hopefully will keep up.
Great. Okay, so I will maybe put a link in our caption for any further addition or action that any of our viewers can take if they want, if that's okay with you.
Yes, yeah, definitely.
Great. Okay, so I'm on my last question right now. It's again kind of tying back this MAiD versus psychedelic assisted therapy. So why do you think that the government is more open to accepting MAiD applications than psychedelic assisted therapy for people experiencing end-of-life distress associated with a terminal illness?
That is a good question, which unfortunately don't have the answer. But I will say this: it's likely there's some element of stigma, resistance. Things like this take fortitude to change. I was going to say take time and things like that, but it really doesn't. The evidence is there. It's obvious there is benefit for this indication. It's likely more a stigma, resistance to whatever decision maker not understanding the evidence fully or not even looking at it. I think it might be turning a blind eye. And with MAiD, that is a scenario where possibly even politically motivated, but I'll say that about MAiD. I'm very happy that we have that. So I don't know why that was approved quicker, or why the process is easier, or why it's been here in Canada for a longer time. I would just say that I'm glad it's here. I'm certainly, when it comes to my dad, I don't want him to suffer at the end like that. And on the flip side, I don't want him to suffer while he's living either. And so that's where the other hand needs to talk to the other hand. Like it's a scenario where, yes, we have MAiD, but we also need psilocybin guided therapy for end of life distress, so people can enjoy those last moments before something like MAiD's needed.
Yeah, I think not to say that I would want, or you would want, or anyone would want to make MAiD harder to access when it's needed. Mm-hmm. It's just, it kind of paints like an interesting contrast when it's so difficult to apply for psilocybin, and it's so much easier to apply for MAiD when one is ending a life and the other could be improving a life. But that's not to demonize MAiD in any way, or to say that we want people to have to jump through incredible hoops when it's necessary.
No, exactly. We just want the other option to be as readily available. That's really it. We want the MAiD access the way it is, and we want certainly much less resistance to accessing something that's going to improve those last days, weeks, months of someone's life.
Okay, is there anything else you want to say on this topic that you think that we missed?
No, I would just say I'm grateful for the opportunity to share the story. I'm grateful for everyone's kind words. Like this is obviously it's a difficult time for everybody, but there's really been some nice things coming in, directly to my dad or being said to be about my dad. And yeah, it means a lot.
Good. Okay, so I just wanted to thank you so much for volunteering your time, joining our podcast. I think I speak for everyone viewing this podcast when I say that we truly hope that Pete can access the treatment he needs to reduce his suffering and increase the quality of life near the end of his life. And I just wanted to thank you again for all the good work you're doing.
Okay, thanks so much.
Bye now.